Hey everyone, Evan Kirstel here with another great discussion. Today we have Ron Emerson, Global Healthcare Lead at Zoom Video Communications, as well as Rama Restigava of Vera Health. Ron, how are you?
I'm doing well. I'm doing well. Good to see you both today.
Thanks so much. And really great to follow up from our meeting and discussion at Zoomtopia just a few weeks back. You have been busy. Your team at Zoom has been all over the place. Maybe introduce yourself and what you do at Zoom.
Yeah, Ron Emerson, as you can see, global healthcare lead. I work with the rest of the healthcare team globally as, we look at providing and sort of helping to close that gap between where people work and how they interact with the organizations and how people interact, or patients, I'm sorry, interact with the healthcare system.
Yeah, and you have a lot of insight into that. Your background is quite unique, so I really like you to share it. Not only are you a nurse, but you're a Marine Corps vet. So thank you for both of those things. Maybe share some background because I was really intrigued.
No, I appreciate that. I guess I never realized, the unique path I was taking at the time. But I was in the Marine Corps. I was in went in like infantry, got in a unit called Fast Company, which is Fleet Anti-Terror Security Team. Got out of the Marine Corps, and then I actually got my bachelor's degree in nursing while I was working for a biomedical company and like durable medical, CPAPs, BiPAPs, O2 concentrators, and then I worked in the clinical setting for a few years, did skilled nursing, home health, and worked in acute cardiopulmonary in a hospital. And then many years ago, way before telemedicine was cool, this is going back to like 2001, I was started as a nurse in a telemedicine network in the state of Maine. So we end up growing it to about 350 sites. And, Evan and Irma, this is way back in the day when we didn't even have reimbursement for Medicare, let alone state Medicaids and private. So we were, a lot of it was grant funding, and we were just gathering information, trying to validate the clinical efficacy, cost savings, and, what the value of moving information rather than people could provide. And I think we all just witnessed a lot of that value, of course, during the recent unnecessary pandemic that we are, I guess, could still consider to be in.
Yeah, absolutely. Tell us about your journey to Zoom, not an obvious destination for someone with such a deep healthcare background, but what attracted you to Zoom a number of years ago?
Well, when I started healthcare in general, it was interesting because as a nurse and even providers, and I've actually asked a really high level trauma surgeon this. He was into telehealth, and I said, why you're a very high level trauma surgeon. He used to run a large a trauma system in a tier one hospital, and he said, because I love trauma, he said, but I take care of one patient at a time. He said, but when I'm actually doing telehealth, I'm making system change, and I'm changing systems of how care delivery can be developed. And I really thought back to my start, and I actually, I really felt the same way. It's interesting to be able to make system change and how care is delivered. Where you can, they're both valuable. Of course, we need individual care, but all of the other things as well. So, very, very interesting and exciting to see. Yeah.
Interesting and exciting indeed. And I learned that, at Zoom, not only are you a household name, of course, but you have a massive healthcare business, like people wise, clients. It really is kind of a well kept secret, but you're helping, so many hospitals, so many health systems, so many patients, practitioners. Tell us about the practice. How's it organized and what you do day to day?
Yeah, it's really exciting. Well, first of all, I think the one thing I do want to make clear is that Zoom did not get into healthcare or telehealth just because of COVID.
Mhm.
Zoom has been in well before 2016. Zoom was in healthcare, and we actually started offering in the United States what's called a business associate agreement, so that we could um, 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 allow our covered entities and organizations, of course, to meet their HIPAA requirements. And when you look at Zoom in general, there's recent studies that you just had some data up there that Zoom is in 9 out of the top 10 hospitals in the world as their telehealth solution. Just in the U.S. alone, we have well over 40,000 business associate agreements. So that's that could be one business associate agreement for an organization with 80, 90,000 people. So that shows you, that we really do focus on connecting across that continuum of care, which is really important to us. But it's not just for telehealth. As we see healthcare, and I think we talked about this a little bit before, Evan, why I get so excited and why the entire team gets so excited, and then I'll talk about the team at Zoom, is because healthcare isn't just about a clinician seeing a patient. That's a key part of it. But it's also about how can we meet people where they're at and reach out and provide that high level interaction for other things just besides clinical care, so that we can actually get patients to participate in their care, right? Rather than just be a patient in their care. And, we believe that being able to reach people where they're at, provide things like, wellness and prevention. So education, better coordination between providers, care coordination, even using technology, video for the whole psychosocial piece, because loneliness is a huge issue for all different ages, but especially as, we see isolation and elderly populations. So we get excited about that whole sort of multi-purpose use case across the enterprise. And then from a clinical perspective, but then of course, we also get excited about people using Zoom the way that you and I, and others use it every single day, which is just for meetings and just collaboration with Zoom phone and all the other things. Because we just had our Zoomtopia that you referred to, and we had some really cool launches there. Excited, just a couple examples. One is we actually just announced what is going to be called Zmail, and it's there. It's great. You'll be able to get your email from Zoom, and then Zcal, and you'll have that one integrated, super easy to use platform that Zoom has a reputation for, and will keep that experience moving forward. One thing that you see a lot of is when you talk about virtual work is the concern about, we don't have an opportunity for the water cooler type discussions. We don't pass in the hall. Zoom's releasing something called Spot. And what that is where there's a certain rooms you can go into where you could have different groups, names of rooms, or you could just have like your team, and you can just kind of bounce in and just go into a room and maybe work with other people on the screen as you're working on your project, and just have them there, just have other people and talk to them. But as you're working, or you could go into a certain room to talk about specific things, but it really gives sort of that interaction, even virtually, so that you can interact on those sort of, flyby experiences that we all experience when we're in person.
Ron, this is so interesting, and I'd like to dive even deeper into this convergence. So we talk about consumerization in healthcare, and sometimes it's just, we're consumers everywhere. Why can't we be consumers in healthcare, assuming that would give us more power, to make choices, etc. So I know healthcare obviously is a very different kind of animal here, but I think what you're talking about in terms of empowering patients and making them feel like they could really participate, that participatory medicine component. So I'd like to know more about how during the pandemic, how Zoom became just a tool of choice for many people to do their business and to connect with family. So did that help in terms of then people being ready to use that as a tool for their healthcare as well? Like what was the driver during the pandemic?
No, those are great points, Irma. And the answer is yes. I think just if you look at sort of the scale, if you look at December of 2019, Zoom had about 10 million daily meeting participants. So about 10 million people got on Zoom a day, right? And then you look at April, so a little bit 3.5 months later, Zoom had about 300 million daily meeting participants, right? And we saw that same escalation in healthcare. So the familiarity of the actual solution itself, the rapid adoption, and our ability to be able to literally spin systems. I mean, I was working with we were going through this with one customer. We spun up 8,000 providers over the course of a weekend, where we started on Friday, and by Monday they were up and running with Zoom accounts and able to reach out and connect with their patients. And as you say, where does that go, right? So the familiarity with the solution being so widespread on a global scale, but I gave you the example of just the number of BAAs in the United States. But I think what's just as important about that, and what I'm really excited about, is the reality is we talk about consumerism, but we're all incentive driven, right? You have your incentives, I have my incentives, we all have incentives. So do providers. And what incentivizes healthcare professionals and providers is how they're reimbursed and how they're paid. We are seeing, from 1960 to 2010, the cost of healthcare actually increased in the United States 5 times what gross domestic product was, which I know you know well. So we realize that just providing sick care and treating patients when they're sick maybe isn't the best way to go. So now about 40% of Americans in 2020 we're actually underneath some other alternative payment system. And what that means for those of you that are somewhat new to healthcare is a lot of times we call it capitated rates, right? So if Irma is a healthcare provider and we say, okay, Irma, we're going to give you $1,000 a month and you're going to take care of Ron Emerson. That's what you get, $1,000. Now, Irma, you do it how you see fit. Whatever you want to do, you do what you do to take care of Emerson. So it's in Irma's best concern to keep me healthy. It's in Irma's best concern to reach out and decrease the barrier and the threshold to access to me coming in the office so I don't go to the emergency room and use more expensive forms of care. It's up to Irma to, if I'm a chronic disease patient, to do things that are going to lower the number of resources and medications I use through lifestyle habits, because all of that comes out of those sort of capitated rates. So we see that as the future of healthcare, not just for Zoom, but where it needs to go. And the backbone of all of that is you're going to need communication across that entire platform and that entire continuum. And we feel like we're in an excellent place to, and we already are providing that, but to expand on top of that.
Fantastic. Tell us about the team that you manage and have built, because if I recall, it runs into the hundreds. What do they do versus the average Zoom person that's built the stack? Like you must have a lot of specialized requirements and deliverables for health.
No, we do. We have some. We do. We have a dedicated healthcare team at Zoom, which a lot of folks don't know about, and we have engineering. We have product engineering. We have marketing. We have distinct sales teams that they only sell into healthcare. Business development teams. We have customer success management teams that only manage healthcare. So all these groups of people do within the organization is we focus on nothing but telehealth. We live telehealth. We breathe telehealth every day. And, part of it, I think, and both of you will appreciate this, Evan and Irma, is that, Zoom, we have a lot of capabilities and people ask, how far are you going to go in the telehealth space? It's interesting because a lot of the success and a lot of the real big movement that we're having in the industry is, we don't hear a lot of CIOs saying, hey, you know what? I need another platform to manage. I need another telehealth platform to manage when I'm already trying to manage 6 across. But what we do here is, hey, listen, you know what? We work out of our electronic health record every single day for in-person and some visits. Integrate your video into that workflow so our providers can mimic what they do on a day-to-day basis. And now we're talking. Now we're decreasing costs. We're not duplicating efforts. Like we don't have, redundant management systems. We don't have redundant medical electronic prescribing. We don't have, redundant e-commerce, and that drives down the cost, but it still provides Zoom to stick with its core competency, which is the quality that all of us are used to.
Yeah, and I remember being on site, and Irma, it was amazing. They had an entire hospital room set up.
I was just going to ask about that, and I was going to help you.
There we think alike. It's a mind meld here. So, and it was set up to sort of proof of concept on different cameras, and you could monitor patients, and there were like sensors. It was much more than just sitting at your PC and communicating like we are now. Tell us about these unique environments you're building, because it was.
I will just say prevention and chronic disease management, very near and dear to my heart because I feel it's very empowering to patients. But what about acute care? People will still end up in a hospital.
Yeah. No, that's a great question. And, and just to give a little background, we talked about me being a nurse, and I was a nurse in rural Maine. And I'm telling you, when we did have a cardiology unit, we had 4 cardiologists, but they go home at night. Right. And there's one on call. But if you're that nurse in the hospital and the patient's having a myocardial infarction, which is a fancy way of saying someone's having a heart attack, you're trying to talk somebody on the phone. And so that leads into Irma, what you're just saying is the inpatient setting. What we really believe, and we know one of the big next steps is sort of the inpatient room of the future. How can we virtualize the inpatient setting? And, Zoom is, and what you would have saw, Evan, is, we're already working with some of the infotainment systems where we can integrate into the TVs and the monitors. Where you can bring in a video call. So think of some of the applications there. Just think of how powerful this is. One would be just for telemedicine. Patient in the middle of the night or rounding or in the day, they have a problem. You can instantly bring a provider in over video, right? The next thing is think of the whole psychosocial piece. When you're in the hospital, be able to visit and have your family involved in your care and just visit them. Think of things like translation services, right? To be able to provide translation services basically instantly when the provider shows up to do their rounds, or they need to have that other high level interaction. There are all of these different applications, and to be able to integrate that into the infotainment systems or not in the infotainment systems, we can do both. And then the other thing you were talking about was, in the inpatient setting would be even like higher level, like let's say surgical, same-day surgery, operating room theaters, is really being able to provide sort of that multi-view ability so that the participants, even if it's a provider, they can really have some of the same experiences if they were in the room, right? You want to see the whole room so you can see the workflow of the room. You want to have a bird's eye view of the patient. You can see down on the patient. The other thing Zoom can do that a lot of people don't know, and we could do this on a regular Zoom calls, we can plug in digital stethoscopes. So put the telemedicine unit on a cart, right? And we can plug in a digital stethoscope. And, Irma, Evan, I could listen to your heart and lung sounds. And I'm telling you, it's impressive because it's digital. And we can plug in multi-purpose scopes. So we could do dermoscopes, handheld cameras, otoscopes, laryngoscopes. We can do all of these different things. And that's all just off the basic Zoom platform as it is today. So there's a lot of exciting opportunities for higher level diagnostics and use cases outside of just, as you said, Irma, sort of the talking video like we're doing today.
Let's talk about nursing. You as a registered nurse and having practiced as a nurse for years, talk about telehealth's opportunity for nursing, training, and education in light of really growing nursing shortage. At bedside, what is the role of this technology?
Yeah, I mean, I think one thing is, let's just start about at the core root of the problem is, how do we get more nurses? And if you think of like a lot of, and this is actually a program I was involved with, a lot of sort of rural hospitals, maybe they have non-traditional, they have students that want to be nursing students, but maybe they're non-traditional. So maybe they're a mother or a father, and they're well rooted in that community with their kids, but they don't have a nursing school right there. They can't go the 3 hours away to be in the nursing school. So what we do see, and there's a vested interest from the nursing schools and the rural organizations, is literally you provide all the didactic part over video, like we're doing it, and the students would actually go to the rural hospital, and that's where they would receive all their class and their didactics. And you have a nurse educator go out there, they do their clinicals in the rural area, and it really provides I don't know if I like the term feeder system, but a system to basically help provide nurses in these rural areas where they have roots and where they're going to stay and where they're already established. So that's some of the educational piece. Now, from a nursing perspective, the other thing that we see is when we move more towards like hospital at home and, more acute patients, and having worked in home health some there as well, is, when you look at telemedicine, the ability to just virtually, come in almost instantly and provide support to a patient is very, very powerful, rather than a nurse having to get in their car. And that's where we stop, Irma, to your point, those exacerbations where we end up having unnecessary hospitalizations and those type of things. Now, as far as the shortage goes, this is something we get asked quite frequently because of the nursing and provider shortage. It's really more about, how we can increase efficiencies and use what we have, the providers and nurses, the best way we can. And I think a good example of that we see is load balancing, where maybe this hospital has almost no inpatient, let's say intensivist, or they have no hospitalist, but this one over here has excess, and then they could load balance and use those services. And we're seeing more and more of that across healthcare systems and organizations to try to meet the needs. And there's just a lot of pressure on systems out there today, healthcare professionals and systems.
Yeah, absolutely. So we have seen some retrenchment around telehealth, and as we get to this sort of new normal phase, also more hybrid work. What does that mean for you in the healthcare practice? Because I don't see any slowing down, but it is changing from just pure telehealth, remote work, to some kind of new paradigm. What does that mean for you guys exactly moving forward?
Well, it's really interesting. So first of all, when you look at Zoom and you look at most organizations, we really do believe in hybrid delivery models for care and hybrid models of how employees can engage with their organization, right? And which is really, really exciting for all of us. So we actually, in 2020, Zoom did we worked with an organization called Qualtrics, which did a study. And we found that patients who'd actually had a telemedicine visit on their phone or in their home, within 6 months, 61% of them actually wanted to move forward with a hybrid model of care. So we know patients like it. 34% said, you know what, good the way I am. And then 4% said, you know what, I want nothing but video. And, you know, in some cases, you know, that might be okay, like for mental health, like those are some of the cases. But I think most of us believe, and patients believe, that it won't be, the future won't be just the de facto, you automatically go to the doctor. The future will be based on the clinical need of what you have. That'll dictate the interaction you have with the healthcare system, just like I think what we do with banking now. I work that with my provider now. I went in for my yearly physical. I'm an hour from my provider. I'm a very busy person, like a lot of us are. And we just automatically, for the follow-up, to go over my results and everything, we just set up a telemedicine visit. It's that simple. It's just like, it's just sort of the way we work together, and it works out perfect. The other one that's important, Evan, is I never thought I would see the day when small rural hospitals or critical care hospitals would actually really, you know, just accept and embrace the reality of not having workers within the walls of the organization of a smaller facility. But because of lack of expertise and the reality of work now and the other abilities besides video, we see so much potential, and we see so many organizations utilizing solutions and using Zoom to actually get like coding people, to get billing, dictation, all of these other things that you can do from a distance. And they're providing those hybrid work models where a lot of people are in person, a lot of them are at a distance. It just depends on what that workflow mix looks like to meet the needs of the organization.
Fantastic. Well, we're getting close to the end of our time here, but as we get into the holidays, what are you looking forward to most? Is it more travel, more work? Are you going to decompress a little bit? What do you do to escape from Zoom calls and email and work?
Yes.
I know it's getting a little chilly up in Maine, so any ice swimming, ice fishing, anything going on?
Probably like everyone else. I'm looking forward to just having some relaxing time and enjoying the small things in life, which is being with my family and spending time with my son, who's at university. He's 18. It's his first year away. Missed him like crazy, and just can't wait to see him over the break. And yeah, just doing the little things, going out hiking, maybe going skiing, you know, those type of things. Nothing big planned.
Nice. Well, you know, thank you so much for what you and your team do, for sharing your insight and vision. And yeah, look forward to getting together here in New England sometime over the winter. We'll pick a snow day and go for a drink. So thanks so much.
Nah, thanks, Evan, and thank you, Irma. I really appreciate it.
No, it's been really insightful,
All right.
and look forward to continue chatting. Thank you.
Okay, thank you. Take care.